Stroke is #1 cause of disability in the United States. So it is very important to prevent stroke from happening to begin with. That comes with healthy lifestyle, knowing your risk factors. But when stroke happens, there are treatment available. The treatment for ischemic stroke are as follows. So we can administer a blood thinner. That's called a thrombolytic. It's basically a clot busting medication. Not everybody can get it. Some people may not qualify, for example, if they're on blood thinners. It depends on the time window where a stroke has happened. That goes through the vein and helps dissolve blood clot. It's given typically within the 4.5 hours from onset of stroke. Another treatment that we have available is called stroke thrombectomy. That is very effective, and when it's done right and fast, can really impact the patient's life. It is a non-invasive procedure, which simply means going up through the blood vessel, the arteries, and removing the blood clot if the blood clot is a sizable blood clot that can be reached. We get access to the femoral artery, which then allows us to navigate into where the blockage is. The way we do that is there are different wires and catheter that allows us to do that. By removing the catheter down there, here, as you can see, we can navigate this thin wire through different part of the arteries that goes from the carotid artery up to the brain and access the blood clot. Once that's done, we have different catheter, such as this one right here, which allows us then to get to the clot and by applying suction at the origin of it to remove the blockage or blood clot. Other thing we can use is what's called stent retriever. This is a special stent that's designed to hold on to the clot and then be removed. As you can see here, when this is deployed or opened inside a blood clot, the blood clots stick to it. Typically it is done together by applying suction and the blood clot staying into the stent, then we remove that to get the blood clot out of the body. After thrombectomy, the patient needs to be monitored closely. So thankfully we have a great neurointensive care unit which the patients go to. Then we start immediately by prevention. People who have a stroke are at risk of having another stroke. And secondary prevention is very important. So we have to identify the cause of the stroke to begin with and start treatment. We have a comprehensive stroke team which sees all the stroke patients within the hospital at downtown and works on trying to figure out what caused the stroke and prevent it. In addition to that, rehab is very important. It's through rehab which allows the patient to get the best recovery available.